healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Hi everyone, this is Stuart Newsom. Thanks for joining us for this week's webinar. Today we're excited to bring you a special recorded session from a recent AAOE webinar featuring our very own AVP of Customer Success, Laura Pata. She's joined by Infinix customer Samantha Towler from Tennessee Orthopaedic Alliance. Samantha shares how automation has improved her team's workflows from reduced portals to denial trends. I think you'll find the insights that she and Laura share to be incredibly valuable. So thanks for tuning in to this session. If you have any questions whatsoever or want to discuss how these strategies might work for your organization, feel free to reach out. We're here to help you leverage AI to drive efficiency and success. So have a great day. So with that, please enjoy this previously recorded session.
Hello, everybody. Thank you so much for joining us today. We are joined by Laura Pata from Infinix and Samantha Towler from Tennessee Orthopaedic Alliance, and they're going to be talking about how AI and automation improved efficiencies in the TOA offices. So without further ado, I'm going to pass it off to Laura to get it started.
Thank you so much. Hi, everyone. Thank you, Samantha, for being here. I will start sharing my slides. Today's agenda, we'll do a quick intros, talking about some automation myths that we have uncovered at Infinix as well as Samantha, and then talk about some efficiencies gained through AI and how it can impact your practice as well. Some information about me: I've been with Infinix for 6 years this month. So I've been with Infinix for a while. I help with the customer success team. I see that some of our clients are on here. Samantha is one of our amazing customers. She is the MRI Patient Services Supervisor at Tennessee Orthopaedic Alliance. She has been with TOA for 7 years. She has a variety of experience and a lot of information to share in terms of how we've helped her, our platform, what AI has done to help improve her processes, as well as, managing her staff. Anything else you want to add, Samantha, on that?
No, I think that was great.
All right, let's move on. Talking about some of the challenges that you had before you implemented Infinix. Can you talk about that?
Of course. We were extremely far behind. It was right around 2021. I feel like we had lost a lot of our staff due to COVID, and we were about 2 weeks behind on all of our MRI authorization and CT authorizations. So when we implemented Infinix, so we were 2 weeks behind, and it took about a week to get completely caught up to where we were doing the same day or next day orders.
And so when you first started, though, you started using us manually. So basically everything that you entered into our system, someone was typing it in, uploading documents, then we would initiate the prior authorization, right?
Yes, we didn't do the HL7 integration until the next year.
Okay. And then how many FTEs did you start with?
We had 7, and I still have 7.
Okay. So your volume has increased, there's been more efficiencies, and you've maintained the same number of FTEs while getting more patients, more revenue.
Yes.
Less miles. Awesome. And then how far are you guys out now? So what's your process? Do you wait to get your prior authorization before you schedule, or do you schedule after you get your prior authorization?
We get the authorization before we schedule to make sure there's no kinks in the process. So we get the order from the doctor, then we get the approval. We in our orders same day to insurance to Infinix.
Okay. And then so how far are days out? So let's just say you put in a case, you send it over us today, you get it turned around pretty quickly, and then you schedule those patients to seen within 2 to 3 days versus 2 to 3 weeks previously?
Yes, we normally can get them in between 2 to 3 days from getting their order from the physician.
That's awesome. And then just so you guys have some information, so TOA is definitely a multi-specialty. They're in joint, sports, medicine. They do basically everything. And Samantha oversees all of the MRIs there. So basically the MRI side of the business, and she makes sure that all the authorizations get done so that those patients coming pretty quickly, sooner rather than later, before some of those issues that she had was the delays. So it was kind of like, how do I get caught up with all the volume, and how do we get to see these patients quicker without, getting some patient abandonment, people leaving, going to another facility. So I think that brings us to our next slide. So a lot of the stuff, that we've read is everyone's worried, is automation and AI going to replace humans? Or, is it, or how is it going to help improve efficiencies, right? Because it's basically just AI and automation is just helping with those labor intensive tasks, those repetitive tasks and helping it complete them. But you can't, especially with prior authorizations, you absolutely have to have someone that can help with the manual side of things, right? So if a payer says you need to fax, or, oh, we only received 6 out of the 8 pages, so you still have to fax again. Someone has to manually do that. There's parts where automation will never, ever, it's impossible. Automation will never, you can never have an end-to-end, fully automated prior authorization process. But Sam, I was hoping that you'd kind of like talk about what happened. What did your staff think when Infinix first came on board? What were some of their thoughts? Did they think that they were going to lose their jobs to us? Where there's a little bit of pushback?
We did have concerns with staff as far as thinking that later on down the road that there would be layoffs basically because we were moving to AI. And that's not what has happened at all. It helps our staff, and a lot of my staff are happier because this is something that took a load off of them. They're still doing all the same tasks they were every single day. It's just we have somebody to do our authorizations for us.
So do you think, how long did it take for them to finally realize, okay, AI, the software platform, it's not going to take my job, it's here to help me? How long did it take for them to adjust?
It took them a while. I would say, especially before we did the HL7 integration, I think that's where they were mostly scared that with us doing the automated process that it would change, but it hasn't changed anything.
That's good. That's good. So, I think they also realize that AI automation is not going to help. You can't just do it end to end. You have to have people to help. So it's like your jobs will always remain. It's not something that will take over. Any additional efficiencies that you think that they've kind of walk away with in terms of, did you redeploy them to do other things? Are they still just meaning are they doing the stat same days? How have you kind of sparsed out their work since Infinix has helped come in?
So I have one staff member who does all of our stat cases in-house. So she strictly just does, if the doctor feels like they need a stat case either same day or next day, that is her sole job. That's what she focuses on every day. And then my other staff are the ones that they do have to get benefits, and they do have to do, make sure we have the costs and everything for the patient before they come in. So they still have all of those same tasks. It's just the authorization piece, which was the heaviest piece, is not something that they have to do now.
Right. So no more calling, no more waiting on the phone for 3 hours with Blue Cross Blue Shield.
Yes, absolutely.
Yep. Okay. I think we have a polling question here for everyone on the line. What's some of your biggest concerns regarding AI and automation? What do you think some of your staff thinks is the biggest issues with AI and automation? Is it they're worried about their jobs, data security, cost of the implementation, how effective it's going to be? Yeah, I can see cost of implementation for sure. How effective it's going to be once it's implemented is another job displacement. And no one really picks up data security. That's interesting. So going back to those efficiencies, I think what a lot of our customers say is the biggest impact is the increase in productivity that they have, right? I think before you had mentioned manually entering into a system, basically our portal is the same portal that you would enter, same information that you would in Availity or any, Carillon. However, I think you mentioned before that your staff was kind of it's labor intensive too. You're putting everything into Infinix. However, Infinix will do the calling, they will do the faxing, they will do the exception handling. But you did a time study on how long it took you to enter in cases versus once the HL7 was actually integrated with NextGen.
Yes, it was when we first manually started doing it. It took me 3.5 minutes to put in a case. That was start to finish the physician information, the patient information, insurance, clinical notes, facility. Yeah, all of it took about 3.5 minutes until we did our HL7 integration.
Okay. And now it's seconds, less than a minute. All the data comes over. We get it.
Yeah.
Start to work
Yeah.
it.
It's less than a minute. Mm-hmm.
That's awesome. So faster turnaround times. Obviously, I think, the patient abandonment thing is pretty critical, because I know before that was some of the issues that I heard, in terms of pain points. It's your patients were going to other facilities close by because they could get seen quicker. The authorizations were getting done quicker because they had the staff. And so I know some of the efficiencies, in terms of, you've been able to save time, get more reimbursements, keeping your patients happy, reducing those. Yeah, exactly. I would say that, you do a lot of manual data entry because, as we know, even our clients will say, okay, well, we have to go to the web portal and put all the data in ourselves anyways. However, when you're doing manual data entry, the letters can get transposed, numbers can get transposed, and those could always affect the authorizations as well, because it's just like continuously putting the same data over and over in different spots. However, with the automation, as soon as it comes over, all the patient demographics, everything that we need to obtain the auth comes immediately over along with the clinicals, correct? Yep. So basically, there's really nothing you guys have to do in terms of sending anything over. It's just cases, the patient's ready, we get the case,
Yep.
and we start.
Yep, we just verify the information and go from there.
Awesome. Okay, so I think we have another poll question. What are some of your top prior authorization challenges? I think this is pretty common the whole times, right? You have your staff sitting on the call for 3 hours getting disconnected. Definitely denials, front-end denials also impacts the back-end denials, patient satisfaction, revenue loss from patient abandonment, long hold times. What's your denials been like since you started with Infinix?
Our denials, so I actually ran some numbers recently. So since December, we had 900 cases, and we have surgery scheduling too. We don't just do MRIs and CTs. We do MRI, CTs, surgery scheduling like musculoskeletal surgeries, as well as pain management injections. So I did our numbers from December to April. There was 900 cases, and we had a denial rate.
Wow. That's good, because what was it before? Do you know? Did you have any baseline numbers in terms of your denials prior to Infinix?
I didn't, only because I couldn't track it. With Infinix, I have the capability of running the numbers and seeing the denial rate and the reasons for the denials, and if we need to talk to the physicians and go from there. Before that, I had no way to track the information because we were using so many different portals, and now having all of the information in one, all of that.
When you talk about some of the denials on the front end, though, but going back to those efficiencies, obviously the AI, how it's helping with your procedures, is able to help shift your staff from doing some of those, like waiting on the phone for 3 hours, and they were actually doing something to help the patients, help your physicians. I know you've talked about this before in terms of since you've been using Infinix, like the doctor stopped complaining, the nurses stopped complaining, like it just helped everything around because you were caught up. So talking about the integration with NextGen. So I know that we are EHR agnostic, so we can integrate with any platform. However, this was actually Infinix's first time integrating with NextGen as well. What was the timing? How long did it take for Infinix from start to finish to complete the integration?
It was about 8 weeks.
8 weeks. Okay. So that's kind of in line. I mean, considering it's the first time that we've integrated with NextGen, that's kind of in line with majority of our integrations, anywhere from 6 to 8 weeks. You have a direct connect, directly removing that manual data process from your whole workflow in terms of, not having data entry. So for sure that helps.
Yes.
And no longer going out to those various web portals. So I think that's key as well.
Yes, it is.
So going back to kind of just looping it all back together, talking about the impact in terms of the ROI. You talk about your labor, your staff. You've been able to maintain the same staff. You haven't had to increase is kind of remained the same, but your patient volume is increased month over month, year over year.
Yes, and our physician volume has increased as well, as we've added physicians over the past couple of years, so that's made a difference too.
And then when you talked about the analytics, do you use our patient analytics dashboard? Is that kind of where you go to see like who your top your top ordering providers are, or your top CPT codes or top payers? Does that help you?
Yes. It has also helped with work from home employees because I can track their productivity as well on there. As opposed to NextGen, there's not necessarily with tasking the way we task. There's not really a way to track productivity in NextGen. So this has helped me send more employees home because I can track their productivity from Infinix.
Yeah, you can. Yeah, exactly. And then the denials. I mean, we talk about front-end denials all the time. Majority of the time when we're speaking the prior authorization language, we're talking about the prior auth denials. However, it doesn't matter even if we get the auth, we don't know what happens on the back end. You still could get a back-end denial. But I know for the most part, we've talked about this, that in terms of your revenue has increased, the denials have gone down. You do get your denial summaries every month. So that helps you with your physician education saying, hey, Dr. So-and-so, looks like every time you get a denial on the front end, it's because conservative treatment hasn't been met, or, it's not medically necessary. There's different things that you could be doing prior to helping us obtain the auth.
It's very helpful.
Do you actually share that information with your physicians?
We do. I have one in particular because I joke with him all the time about it. We weren't doing 6 weeks of conservative treatment. He was trying to figure out why his denial rates were so high. So we sat down and talked to him and just let him know that a lot of them were getting denied because he would see the patient one time and it wasn't necessarily an injury code. So insurance was automatically denying it because we didn't see the 6 weeks of conservative treatment. So he is now, unless he knows it's an injury and can get approved, he's seeing all of his patients for 6 weeks before he requests an MRI.
That's good. So you were able to kind of like get the trends, help him with it, and yeah, it makes him a lot happier too, I'm sure, as well.
Yes.
Not with all the denials, appeals, peer-to-peer, anything like that. So
Yes.
and I know that was kind of one thing for you too. You're just like, the physicians are off my back, the nurses are off my back. We're able to keep up with the schedule. There's no issues with the auth not being obtained.
Right.
That's always a good, talking point, because I think it's critical. I mean, you want to keep your staff happy too, and your physicians.
Absolutely. Yes.
All right. I think, that's, well, we do have another polling question. I wasn't ready for this one. Are you planning to implement an AI solution in your practice within the next year? And I know you, Sam, are starting with eligibility benefits shortly, right? So same technology, same thing via HL7. You're going to start manually, move to the HL7 after your team has gotten kind of used to it.
We are.
Anything else that you or TOA will be implementing specifically?
Not at this very moment, but I have a lot of different projects that I try to help with. So I definitely want to push it for sure to other departments.
Awesome. Sounds like everyone's a yes too. Well, I think you have done an amazing job, and we can't tell you enough how much we appreciate you sharing your story and your successes with everyone, especially, working with us for so long. I think it's been 2 years, 2 years?
It'll be 3 years next April.
Years. Yeah, it's been quite the journey, and you have just remained such an amazing customer for us and a huge advocate, and I can't tell you how much we appreciate this. I'm not sure if there's anyone out there, on the call who has any questions that we can answer, that Sam can answer about her experience, anything at all.
I got something in the chat to host and panelists. So someone's interested in hearing in a little bit more detail from you, Sam, about how your staff reacted to the introduction of AI and automation. So can you go through a little bit more detail on what their specific concerns were and how they were alleviated?
Yeah. So in the beginning, doing the manual process, they weren't as worried about it. It was when we went to the HL7 integration and it was going to take less time to put the cases into Infinix than it did originally with that 3.5 minute time frame. And then, of course, depending on clinicals, if we've seen the patient for 6 months, then you're uploading every single piece of clinical that you have. So their concerns when we went to the HL7 integration is that basically that we would just weed out staff. And I've kept all of the same staff. The MRI department hasn't really had a turnover, and I think I have partially some to credit to Infinix because my staff are a lot happier. They're not having to go to 15 different portals to do one authorization and then switch to a different portal. So it's made a huge difference for them. And I feel like they're all really comfortable in their positions as far as they don't have concerns anymore like they did before.
Awesome. Question specific to next gen. So what does the staff put in the order for surgery to initiate the prior auth?
As far as putting them into next gen electronically?
It's probably what's triggering the orders to come to Infinix. So like when you have an MRI order, what's the rules or the logic behind us getting that case? How do you guys set that up?
So as far as next gen, we have all of our orders that come over MRI, CT, and as well as surgeries. They all come through orders module. Whoever asked, I'm not sure if you're familiar with next gen, but they all go through orders module. And as soon as the order goes in, it triggers. There's a drop down menu where we can send it to Infinix. So it doesn't necessarily trigger it when the order goes in. I have one staff member
push the button to send it then.
Yes.
Okay.
So once that's sent, it takes like 4 seconds to send to Infinix. And then the case is available in the drafts and we can pull those and make sure we have all the information we need.
Awesome. Katie, who asked the question, said perfect. Thank you. All right. So another question, and this can be from both of you. So I guess from the practice administrator perspective, as well as from, a vendor side, what advice would you give other healthcare organizations considering similar AI integrations in the future?
That's a good question, but Sam, I'll take it. You actually had Print it.
I have been blessed with Infinix. I had one person that walked through every piece of it with me. I would make sure for sure that you have somebody that's going to be on your side and that wants you to be successful, because if it wasn't for the staff I had at Infinix to help me through it, I don't know that we would have done it. So I'm thankful to the staff at Infinix for helping me get through everything.
How much time did your IT team have to put towards working with Infinix in this and getting us up to the integration up to speed? Did it take a lot of time from your IT side, or is it mainly next gen, or who worked with on the TOA side?
Our specific IT guy that I'm talking about is a genius, so it didn't take him very long. He has been with us for years and knows next gen in and out like the back of his hand, as well as HL7 integration. So that definitely helped for sure, having someone on our side, and they could communicate with Infinix and make sure that we had everything we need.
They spoke the same language. I know every time I listen to those integration calls, I'm like, what? What does this mean?
I don't understand any of it. Not a bit.
So just to kind of piggyback off of that a little bit, when you guys were going through the process, did you ask any specific questions to understand what the level of support from Infinix, or I guess any other vendor in the future, would be, to say, just get that specific answer from them on how they were going to go through that process with you?
I wouldn't. Timeframes was the biggest thing for me. Mm-hmm. Yeah, when we sat down, they stuck to every time frame that they had told me. So we sat down and we did our manual integration. That took just enough time to get all of our information, our physician information, our facility information, so forth and so on, to get that into the system. But we were rolling out manually. So a big thing for me was time frames, definitely.
Okay. And it does. The integrations, it's no secret. It takes time. You have to have all three parties. You have to have next gen, you have to have yourself, and then Infinix kind of working together, trying to meet those same time frames. And so that's kind of usually the biggest hiccup, is just sometimes you don't always get a response from the EMR. So there's lots of different caveats in terms of what could and could not happen, and could delay things, or maybe it actually pushes things up. It just depends on, how quickly we communicate and get back. But
yes. Well, and I would, definitely do your research. Infinix was I first had started an MRI, it was this is too good to be true, but it is what it is. They laid it out, and it has done everything that they said it would do. So
awesome. All right. We just have one more here. So how do you foresee the role of AI and automation evolving in your practice over the next 3 to 5 years? I know you mentioned pushing this out to other departments, but is there anything else you want to touch on?
Just that, we will push it definitely to other departments as much as I can, because it's done wonders for my department. And surgeries as well. We've been doing those since the beginning of December, pushing it out to our physicians, doing some of them little by little. But we are doing a couple of other things for AI integration. So this isn't the only one, but it's definitely shown the most success for sure.
All right. I don't see that anything else has come through either in the chat or in the Q&A. So as a reminder, this session has been recorded. If anyone has follow-up questions for either Samantha or Laura and you need help getting connected with them, you can always reach out to education@aaoe.net as well. But thank you, Laura and Samantha, both for your time today. And thanks everyone for joining us. We'll see you the next time around. As a reminder, coming up later this month, in just about 2 weeks, we are having an AI summit. So if AI is something on your radar, or anybody on your staff's radar, definitely consider joining that. Even if you can't attend the full time, all of those sessions are going to be recorded and in the AAOE Learning Center afterwards as well. And so if you are going to be integrating AI, or in the beginning stages of just learning about AI and its impact, we've got information from a legal standpoint. Samantha is going to be talking about a use case on that. And we have other presentations as well. So check that out on aaoe.net/events. And if you enter the code FLASHSALE, FLASHSALE in all caps, you can get a discount on registration for that event. So thanks everyone so much. We look forward to seeing you again. And thank you, Laura and Samantha, again for your participation.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's INFINX.com.